Thank you for choosing Broward Health for your upcoming joint replacement procedure. Our teams at the Joint Replacement Centers at Broward Health are looking forward to caring for you. This video will cover important information to prepare you for your surgery, what to expect during your hospital stay, and how you can stay safe once you get home. We will also share information on life after a joint replacement. The first thing we want you to know is that you picked a great place to have your joint replacement. The Joint Replacement Centers at Broward Health are certified by the Joint Commission for both hip and knee replacement. We use advanced clinical guidelines to help ensure you have the best possible outcome. Your comfort is also important to us. All of our joint replacement programs offer patients private rooms, and dedicated orthopedic team members will take care of you before, during, and after your surgery. You are in great hands with our teams. The first step on your joint replacement journey is preparing for the surgery. Prior to your surgery, you will receive a comprehensive guidebook for hip or knee replacement. It has a lot of information in it, as well as things that you can do to help you optimize your surgical recovery. Joint replacement should really be part of a complete wellness program. Your guidebook includes a pre- and post-operative exercise program. We encourage you to start these exercises now to strengthen your entire body as you prepare to have surgery. It is also recommended that you do not smoke for at least 12 hours prior to your surgery. Smoking can increase your risk for complications following surgery. You should also avoid drinking any alcohol for at least 24 hours before your surgery. If you need dental work, we suggest you complete it at least 2 weeks before surgery. In addition to preparing your body for surgery, it's also important to get your home ready too. Preparing your home is an important step in keeping you safe and aiding in your recovery. You should perform a home safety assessment and look for potential trip and fall hazards. You should also remove throw rugs and clutter, as they can be dangerous. We also recommend you get a non-skid shower mat. Use chairs with armrests to provide support when you are going from a sitting to standing position. Having these things in place will make recovering at home easier and safer. A few other helpful tips are to have all of your laundry done and having clean linens on your bed. You may also want to prepare some meals in advance and freeze individual servings. These things will go a long way to making your road to recovery a lot easier. Most importantly, stay positive. Breathe deeply and relax as you prepare mentally for surgery. A positive and relaxed mindset is very important. Remember, you are in great hands with our team. Before your surgery, please ensure that the following steps have been completed. It can be overwhelming, so a checklist of these things is in your guidebook to help keep you on track. Verify with your insurance company that you have coverage for your surgery and any physical therapy that may be needed after discharge. Attend the total joint replacement preoperative class. You can contact the program coordinator to register for class. See your primary care physician to obtain medical clearance 1 to 4 weeks prior to your surgery date. As a part of our patient safety measures, COVID-19 testing is required 24 to 48 hours prior to any surgical procedure. This is facilitated once you are cleared and scheduled for surgery. Make an appointment for your first outpatient physical therapy session if recommended by your surgeon's office. Prepare your home as we have already suggested. Arrange for someone to drive you home from the hospital and to your follow-up appointments after surgery, and for someone to take you to and from outpatient physical therapy. You should not drive until cleared by your surgeon. There are also some important things that you should discuss with your doctor before surgery. For example, your primary care physician may suggest that you see a specialist, such as a cardiologist, for further testing prior to surgery. Ensure you follow up with any additional consults that may be requested. Anti-inflammatory medications, such as ibuprofen, naproxen, aspirin, and some vitamins and supplements, may increase the risk of bleeding during surgery. It is recommended that you stop taking these medications 10 days prior to surgery. Please be sure to discuss this with your doctor. If you are taking blood thinners, such as warfarin or Coumadin, these medications will also need to be stopped prior to your surgery. Contact your doctor to find out when you should stop taking your blood thinner. You will need a rolling walker and other durable medical equipment following your surgery. Contact your surgeon's office for assistance with obtaining this equipment. As your surgery date approaches, here are some reminders on what to do the day before your surgery. Make a list of all the medications you are currently taking, including the dosage and frequency. Bring this list with you to the hospital. Keep a list of any allergies you may have and the reactions you've experienced. People always ask what they should bring with them to the hospital. On the day of surgery, bring your insurance card and photo ID. You'll also need to pack some comfortable, loose-fitting clothing and walking shoes with non-skid bottoms that can be worn during your therapy sessions. Bring useful devices such as your eyeglasses, hearing aids, or CPAP machines. Bring a copy of your Advance Directive or living will. This will be added to your medical record. You'll also need a list of the medications you are currently taking. You won't need to bring the actual medicines with you. The hospital will provide you with your prescribed medications during your stay. The Joint Replacement Guidebook is a great reference tool for you. Bring it with you on the day of surgery. A telephone will be available in your hospital room. However, you may also bring your cell phone to stay in touch with family and friends. Please leave valuables or jewelry at home. You won't need them while you're in the hospital. The night before your surgery, remove your jewelry and keep it in a safe place at home until after your surgery. You will be provided with a special antibacterial soap called chlorhexidine to prevent surgical site infection. Shower using half the bottle the night before surgery and half the bottle the morning of surgery. Follow the instructions provided. Do not use any powders, lotions, oils, deodorants, makeup, or hair products after showering with the chlorhexidine. You will have nothing to eat or drink after midnight the night before your surgery. In an effort to enhance your recovery after surgery and promote healing, you'll be provided with a 12-ounce bottle of Gatorade to drink the morning of your surgery. Drink the Gatorade 2 hours prior to your scheduled arrival time on the day of surgery. On the morning of your surgery, be sure to arrive at the hospital's preoperative registration area at the time you have been provided. Upon your arrival, you'll be registered and receive an arm bracelet. Once you are in the preoperative area, an IV will be started and lab work will be completed. Your consent for the procedure will be obtained at this time as well, and the surgical site will be verified. Your current list of medications will be reviewed with you and added to your medical record. The anesthesiologist will also speak with you and may administer medications for pain or nausea if necessary. Joint replacement surgery typically takes up to 2 hours. Following the surgery, you will be in the recovery room for approximately 2 hours, where you will be monitored closely with frequent vital signs. Compression stockings and devices will be applied along with cold therapy. From the recovery room, you'll be taken to the orthopedic unit. Don't be surprised that you will have the opportunity to stand and walk with assistance from our nursing and rehab staff. The morning following your surgery begins with the collection of lab work and vital signs at approximately 5 a.m. I know that sounds very early, but this begins the process of getting you ready for the day. You'll be helped with bathing and dressing and assisted out of bed to the recliner chair in your room. Breakfast is served around 8 o'clock. During breakfast, your pain will be assessed by the nursing staff. Please notify them if your pain is worse than mild, so we can address it. Physical therapy sessions are planned after breakfast and after lunch, where you will have the opportunity to perform post-operative exercises and walk with your therapist. It is important to remember that you should never get out of bed without assistance. Please call us. We're glad to help. Deep breathing exercises are important to reduce the risk of pneumonia. Please use the incentive spirometer device in your room 10 times each hour when you're awake. Compression stockings will be provided to you. Please wear them as instructed. Our staff will visit your room regularly to ensure you have everything you need. Please alert them to any concerns you may have. We're here to assist you and make sure you have everything you need. We want to help you through every stage of your joint replacement journey, including staying safe at home after your surgery. So here are some helpful hints. Continue your pain medication every 4 to 6 hours as prescribed. Taper off slowly following surgery until it's no longer needed. Take medication 30 to 45 minutes before therapy. And take your blood thinner as prescribed. Elevate your legs when seated to prevent swelling. Take stool softeners and/or laxatives as long as you are on pain medications or as directed by your physician. Remember to use ice therapy unless otherwise instructed by your surgeon. Use your walker as directed. Continue use of incentive spirometer and continue with your exercise program. Remember to perform your post-op exercises when you go home, twice a day. Schedule a follow-up appointment as specified by your surgeon, and follow up with outpatient physical therapy as well. Take care of your incision and post-operative dressing as ordered by the physician. Practice proper hand washing because this is very important to prevent infection. Our goal is to help you avoid any post-operative complications. Let's review some possible complications along with ways to prevent them. Blood clots. You can help prevent blood clots by using the compression stockings, blood thinners as prescribed, exercises, and mobility. Report swelling and redness and any warmth immediately to your physician. Pulmonary embolism. These can be life-threatening. Report shortness of breath, confusion, chest pain, fast heart rate, dizziness, and/or sweating immediately. Surgical site infections. You can prevent these by hand washing and keeping dressings dry and intact. Do not submerge your wound in water until advised by the surgeon. Report warmth, redness, swelling, discharge, and fever immediately. Pneumonia. This is prevented through mobility and continued use of the incentive spirometer. Report any fever, cough, and/or shortness of breath immediately. Urinary tract infection. You can help prevent these by drinking plenty of liquids and using good personal hygiene. We also avoid the use of urinary catheters. Report any burning or pain upon voiding, fever, increased frequency, or blood in the urine immediately. Pressure injury. These are prevented by mobility. Avoid friction, moisture, and maintain good nutrition. Report any redness, burning, or any discoloration, especially over bony prominences, immediately. We know that this overview seems like a lot of information, but don't worry. Our team is here to help you every step of the way. Our joint replacement coordinators are available to answer any questions you have. And don't forget about your guidebook. It's extremely detailed and comprehensive. Thank you for choosing Broward Health for your joint replacement surgery. We are committed to providing you with the highest quality health care. Once you are discharged home, you will receive phone calls so we can follow up on your well-being. You may receive a survey in the mail from our confidential survey provider, Press Ganey, after your surgery, and we encourage you to fill it out. This is your opportunity to tell us what we did well and how we can do better. Your feedback is very important to us. We hope you found this video informative and look forward to seeing you soon. To reach the Broward Health Joint Replacement Center of your choice, please use the following contact numbers.